How do we ramp up the vaccinations in the country? Now, the centre has said yesterday that door-to-door vaccination against COVID will not be feasible, even as it's asked states to ensure 100% saturation of vaccination. Now, that means that complete the vaccinations of the priority age groups, which from 1st of April is above 45 years of age, and complete that in the next fortnight, especially in districts where COVID cases are surging. So, is it time for a change in strategy? Do we need to think out of the box to drive up the vaccine numbers? Well, we are joined now by Dr. Rajesh Parekh, Director Medical Research, Jaslok Hospital, and Dr. Anita Ramesh Chandra, Clinical Trial Specialist, joining us there from Chennai. Thank you both doctors for joining us again on the show to discuss all the different crises that break out. And Dr. Anita, first to you. Is it time to, change our strategy? We do know in Ludhiana, in Punjab, they might be going door to door. They're going to open up the vaccines. In Mumbai as well, they've made a request for door to door, though that hasn't been accepted yet by the centre.
Yes, you're right, Gargi. I think this is a time because the second wave is rising and you know how much of the cases are rising. I'm in the hospital. We are in short of beds and patients are again piling up in the OPD. So it is very, very important to have innovative ideas for vaccination drive. Yes, government has done so well. It is so good. 1st of April, we are opening up to 45 and above. And I think also we need to open up to the college-going students and those who are going for work, those who are on election duty, those who have regular duty works. Yes, door-to-door vaccination, I do like it also, like how we give the oral polio. But remember, polio is only for children, but this includes a large number of people. Yes, those pilots, trip, who are working in the defense, all alert jobs needs to be vaccinated. Yes, and all private sectors, all hospital, all dispensary has to open up. And what I feel, the vaccine is safe. I have taken both the doses and all the people taking in my hospital is very safe. But you can also open up giving vaccination in small dispensaries all around India. You know, in India there are many private practitioners who are practicing in the local places. So open up everything so that people can walk in, take the medicine, and it can be door to door, because I know I have an old great-grandmother who is 90, but then she cannot come to the hospital, so we have not vaccinated her. So yes, door to door, put in all your steps, all the innovative ideas and vaccinate, because Indian vaccine is quite good and the results are very impressive.
Right. Hopefully we'll get more vaccine soon as well. Dr. Parekh, your view on that? What are the challenges you foresee in trying to open it up? What are the reasons the government, the central government so far is, reluctant on this? It'll also help convincing people, because many people aren't going to the clinics, but if the medical practitioners actually come to them and try to convince them, we'll see numbers going up.
Well, good afternoon, Gargi. It's always a challenge to carry out any program on a door-to-door basis. There are issues that could come which could set the whole campaign behind. For example, if there is anaphylaxis or severe allergy reaction which cannot be controlled in the home, it will be all over the media, and that will give the program a setback. Even the polio campaigns or the smallpox campaigns, which we carried out successfully, were not done door to door. So that is understandable. But, you asked a very interesting question twice over, and I cannot resist the temptation to answer it, that is it time to change strategy? Gargi, it's always time to change strategy, because unlike a discussion on television where we have all the graphs and charts in front of us to be able to discuss it in a contemplative manner, in the real world outside there's chaos, it's dynamic, the situation is changing constantly, and just as the virus is mutating, our thinking has to mutate, our plans have to mutate, and we have to move fast. If you have a minute, I'll tell you how this can be done.
Yes, go ahead.
So who do we listen to? Well, I'm glad you started with Professor Mukherjee. I didn't mind the wait at all. The data scientists are the people who we should listen to. They have been right all along. Last February, when we wrote the first book on the coronavirus, we used mathematical models which are fairly robust, and till today those models have held up. We wrote a policy paper in December warning of the second pandemic, which occurred 3 months later, and what to do. Here's the problem. As Bertrand Russell once wrote, the problem with the world is that fools and fanatics are full of certainty, whereas wise people are always full of doubts. So Professor
Right.
Mukherjee and data scientists, those of us who look at data, are always talking in uncertain terms, which is the way it should be. We're talking of probabilities. And yet you will have politicians talking of certainties. Everything is under control. We are going to wrap this up very fast. I think it's time that we spoke with and listened to the mathematical models, the data scientists a bit more, and need to be a less
Right,
certain of ourselves,
absolutely.
less
And, you know, we have
confident and humble.
this dichotomy in the sense you have the, health ministry talking about states need to, pull up their socks, quicken the vaccine drive, ensure protocols. But then on the ground, we're going ahead with the campaigning. We have the Kumbh Mela that is beginning, which is the largest gathering on earth. And, so different things are happening on the ground and different things happening from the government and here in TV studios. Thank you so much, both doctors, for joining us once again on the show. And we will, of course, return to you for more on this story as the coronavirus situation is evolving in the country.